Hi everyone, welcome. I'm Sophie Anderson. I'm the founder and upper cervical chiropractor at KOEO, which is a upper cervical chiropractic and massage center based in central Barcelona. I'm here today to talk with Lisa Santamera, who's an incredible TMJ or jaw therapist who's collaborating with me. Now, I have lots of clients that come to me with upper cervical issues, and this area of our body actually controls and talks to our jaw, our head, as well as controlling all of the global systems in our body. So I see many clients who have an issue going on in their jaw, and they tend to fall into two groups of clients. One group tends to, once we correct this issue, that whole jaw problem can sort itself out. Another group, which tends to have, I notice, problems going on either in the disc, the little disc of the jaw joint, the tracking of the jaw, something more structural inside the jaw. They often need some more specialized care. And that's where someone like Lisa, who's working with TMJ or jaw dysfunction, comes in. So welcome, Lisa.
Thank you, Sophie. Hi, everyone. I'm delighted to be here. I'm Lisa, and as Sophie has said, I'm a massage therapist, and I specialise and I love to work in jaw therapy for TMJ dysfunction. And I'm also delighted to be part of the KOEO team of collaborators.
Amazing. All right, Lisa, so then why don't you share with us a little bit how you got into the massage and what led you in that direction in the first place?
Yes, thank you. So I love practice and massage, and I have been doing that since 2014. And I feel like massage is in my blood because my mum was an aromatherapy massage therapist. So we always had essential oils at home, and she would often mix them and massage us and mix them in different combinations to help with our energy levels or our focus and concentration or pain in the body. Or if we needed help in getting to sleep and things like that. So we grew up with that around us, and we also used to just do what we called to squeeze feet when we were just sitting watching television together. So we loved any kind of massage. And when my mum was studying and when she was practicing, she would also give us massages. So it was something that we really grew up with. And then I went on to study for my diploma in massage in 2014. And I kept up the practice part-time whilst I was working full-time in other jobs. And then in 2016, I ended up with symptoms of TMJ dysfunction or TMJ disorder myself when I was going through a really emotionally stressful time in my life. So I then went on to study the advanced techniques of TMJ dysfunction therapy. That was in 2018, just to educate myself really on what was going on with me, and then to be able to bring it to my massage clients. Because I'd experienced the TMJ symptoms firsthand, I knew how painful and disruptive they could be, and I just wanted to share that with my clients.
Amazing. Now, so we've mentioned jaw and we've mentioned TMJ a couple of times. So can we just share what's the difference between jaw and TMJ?
Yes. So the short answer is there is no difference, but we do use TMJ, the acronym, in a couple of different ways. So TMJ stands for the temporomandibular joint, which is this one just here. And you can actually feel it yourself if you place a couple of fingers just in front of your ears. As you open your mouth, you'll feel your mandible bone, which is this one, the lower jaw bone, that will drop down and glide forward slightly. So if you've got your fingers here and you open your mouth, you should feel that happen. And when you close your mouth, the mandible bone should fit neatly back into its home in the temporal bone, which is this one here in your skull. And that's where the joint takes its name from, because it actually connects the temporal bone and the mandible bone. And the TMJ joint sits here in between those two. And in between those two bones, there's a little disc of soft tissue that helps to keep the correct tracking of the jaw, so it keeps it in place, and also to make sure that it moves smoothly. So if you do check your own TMJ and you feel a clicking or pain, or you feel some movement to one side or the other, we'll discuss later why that could be happening and what can be done about it. But that is the TMJ, the actual joint itself. And so, as I said before, we also use TMJ. We use TMJ in a couple of ways. So one is to name the joint itself, but also, maybe confusingly, we use the same acronym to refer to the symptoms of a dysfunction in the joint. So if anyone does have any symptoms of TMJ, or if you've been diagnosed by your dentist, you may say that you have TMJ, which is referring to the disorder or the dysfunction that can happen in the joint. There's also TMD, which is used, and TMJD, D standing for disorder, and they all refer to the same thing. So there's a few different names, but we mostly use TMJ.
And so then this is the joint that I'm using now whilst I'm talking to you. I'm using it whilst I'm eating. So it's quite a busy joint.
Yes. It barely rests, I would say, because as some people with TMJ will know, it's also active during the night. It is one of the most used joints in our bodies, and it's one that we may never really think about. It just day in, day out, it will just do its job for us, and that's perfect. But if you do have TMJ or TMJ disorder, you will definitely be aware of it, because your attention will be there because of the pain or the clicking that you might feel. And it is used so much, and it's great that it does its job so well, in the majority of people. But the placement of that disc that I mentioned that sits between the two bones is really important, because it absorbs the shock of those two bones coming together. And we want to make sure that disc stays in place and is functioning really well. So there's a last couple of things that I'll mention now about the joint. And the first is that the mandible, which is the lower jawbone, is fixed in place by suspension. So it's held in its correct place by a collection of muscles and soft tissue. And when you think about it that way, you realize how vulnerable it can be to misalignment or some kind of affectation as a result of other issues in the body. And the second thing is that these muscles and the bones and all of the soft tissue in the body actually are all enveloped in something called fascia. And that is a huge topic, which I think we'll need to talk about in its own dedicated chat later. But I just wanted to mention it here, because many of the techniques that I use during the TMJ Jaw Therapy session is working directly on the fascia. And the fascia itself is a functional system of connective tissues that runs through the entire body. And its function is to make sure that all of the bodily systems operate in an integrated manner. And to highlight its importance, it's also sometimes referred to as the tissue of movement. So we will often think that our muscles cause movement, but the fascia is very integral in those movements. So it's good to just sprinkle here that if the fascia becomes tight, then it can restrict the proper and fluid movement of the muscles and bones, and that can be a big contributor towards developing TMJ. Maybe we can speak about that another time, but I just wanted to share here the top line of what can be involved in TMJ.
Yeah, and that makes total sense to me, because the work I'm doing as an upper cervical chiropractor, when somebody has an issue going on up here, their body makes a compensation. So they're often twisted and compensated, and we know that the fascia is involved in that. So when we make those corrections and the body starts unwinding and the fascia starts unwinding, and that person's body can return to a normal balanced state, I think that's why a big majority of the people who have just a simple imbalance going on in their body that's creating that tension up through the jaw, that's why that completely clears and connects. Whereas then, like I said, there's that second group of people who, once the body's balanced and the jaw is still a problem, it lets us know that there's something deeper going on inside that actual joint, or maybe inside some of the muscles or the ligaments, and then that would be that perfect kind of person that you could your sessions could help. Okay, so we've clarified that TMJ is both the joint and the disorder. So how would somebody know if they have TMJ disorder?
Yeah, okay, so there are very many symptoms of TMJ, and they can include bruxism. So that's a big one. So if somebody is clenching or grinding their teeth, that can be related to TMJ. People often feel a clicking or a popping of the jaw, and particularly if it's audible to them. So if they can feel the click but hear the click and it's accompanied by some pain or discomfort, that can also be an indicator. Others may have difficulty in opening or closing the jaw. There's pain in the jaw when they chew and bite. In some people, there may be a very significant deviation. So if when they open the jaw, it moves over to one side or the other. And then there's just more generic symptoms like jaw, face and pain, neck and shoulder pain is very common. Headaches and migraines can be involved in there. And then some other satellite symptoms such as ringing in the ears or tinnitus, vertigo and earache. So there's a broad spectrum of symptoms and they're quite far reaching. So for example, you may not necessarily link that your shoulder pain is linked to the jaw, but it often is. And so people very commonly have really different symptoms to one another as well. So for example, if I have TMJ and my symptoms are jaw and face pain and I'm grinding my teeth, you may also have TMJ and your symptoms could include headaches and clicking of the jaw. So we both have TMJ, but just with very different symptoms.
Right, yeah, that makes total sense. And then what might actually cause people to have the TMJ dysfunctional disorder from your experience?
Yes, so this is an ongoing discussion as to what causes TMJ. There's still discussion happening as to whether certain symptoms manifest as TMJ or in TMJ, or if TMJ causes those symptoms. So it's a bit like the chicken and the egg, which comes first. But there are some known causes of TMJ and we can house those under different umbrellas, if you like. And a few of those could be stress on the fascia, which we mentioned before, which can affect how the bones and muscles and all of the soft tissues move together. Any injury or trauma to the body is a very obvious one, let's say, because if you take a cricket ball to the jaw and then you have jaw symptoms, that's a very obvious cause. And then stress and emotional strain can very often center itself in the jaw as well and cause TMJ. And that last one is really interesting to me because, as we know, and I'm sure that you see a lot in the people who come to you for upper cervical chiropractic care, stress or an imbalance in the nervous system can manifest in the body, and TMJ is no different. It can 100% just almost absorb the emotions and stress of the body, and it can cause those symptoms that we mentioned earlier.
Yeah, absolutely. I think often when we talk to people about their health history, people are so it's easy for us to remember those physical accidents, those physical traumas, and often we don't associate the emotional and mental stress with a physical response. But it absolutely is like I always like to describe an emotional trauma. It's just like another car accident for your system. Okay, and so then what about if somebody's jaw is clicking? Why might that be happening?
So I think I think a lot of people will recognize that their jaw clicks, and it could be major or it could be minor. And so that can be a sign that the disc that we mentioned earlier that sits between the two bones is coming out of its usual place. And very often it will either travel too far forwards or too far backwards and will cause that clicking sound as it comes in and out of place. And with those disc issues, some people will have a really good change following a course of TMJ Jaw Therapy sessions. And a minority of people may see a significant improvement, but may not feel like it's 100% corrected. And for those people in particular, if it's still causing pain or discomfort, I would then recommend that they seek some additional care from their orthodontist.
Yeah, perfect. All right, so you've shared with us about the TMJ being the joint and also the name for the problem, okay, with the dysfunction. We've talked about the types of symptoms someone might experience. We've talked about the types of causes that can be creating that problem, which can be that fascial, that can be that physical injury or trauma, and also the emotional stress and traumas. You've talked to us about the special disc. So lastly, who are the people in your experience that would benefit the most from TMJ therapy?
Yeah. Okay. So as we've mentioned, those symptoms are there's a wide range of symptoms. So I would say, I don't think everybody who has some shoulder tension or a click in their jaw necessarily has TMJ and would need any particular care for that. But if people recognize they've got a collection of a few of those symptoms and it's causing some disruption to the functioning of their jaw, then they may want to come and just get checked out. But to be honest, people generally know if the TMJ needs some TLC because it's quite apparent to them. Either they're very obviously grinding or clenching their teeth, or they have the sensation of it when they wake up in the morning. So people can grind and clench their teeth during the day, and some people can do it also overnight or only overnight. And that is what happened for me. So I had a deep aching and almost like a really tired feeling all through these bones when I woke up in the morning. So I knew that I was putting a lot of pressure there through the night, and it was very obvious to me. So it may feel the same for others. Another really clear way to know is if people have actually been diagnosed by their dentist. So dentists can diagnose TMJ and they may be able to help. But when it comes to working on the soft tissues and the fascia, like we've mentioned before, they may refer people to someone like me who will work on those tissues for that specific TMJ care. But I would definitely say to not panic. Not everyone with symptoms actually has TMJ, and that's it.
Great. All right. Thank you so much for sharing all of that with us, Lisa. It's pretty obvious that you're quite passionate about TMJ, and I know that you've got that personal story from your own experience. Is there anything else you'd like to share about that story around your own jaw problem?
Yes, yeah, more than happy to. So I wasn't really familiar with TMJ before I had my own symptoms and it came up in me. My own TMJ started about 5.5 years ago when I was really emotionally stressed. And I was, during the day I was functioning and getting what needed to be done was getting done. But overnight, I was obviously just kind of focusing all of the additional or residual stress on my jaw. And as I said before, I would wake up and it would be so sore and so like a tired feeling. I felt like it had just been working all night. And so I felt like my head had been under a lot of pressure through the night because of the force I was using to clench my jaw. while I was asleep. And mine was actually coupled with deep shoulder pain and stiffness. And I just felt altogether very off center, you know, just not well, not right, and just feeling not good, really.
Yeah. And did you at that time have anyone that could give you some TMJ therapy?
Oh, I wish, and I wish I knew, I wish I'd done something about it sooner, to be honest, but I didn't see anybody specifically for the TMJ, no. I had one appointment with a physiotherapist for the shoulder pain, but I feel like if I'd known then what I know now, I would have done things differently. I was in the UK at the time, but I was living in Barcelona, and because I was in between places and there was a lot going on, I neglected the TMJ issue really, and I still have some issues with it now. And this was all in 2016-17, and then, as I said earlier, in 2018, I did the training for those advanced techniques for TMJ. And as part of the training, we would learn the techniques and apply them to our classmates. And then, so I would also receive TMJ treatment. And that is when I actually got some dedicated care for the TMJ. And when my neck and shoulders particularly were being worked on, the pain that had been stored there was just incredible. The initial shoulder pain that I'd had subsided a lot, but I was just unaware that I was holding so much stress and tension in these neck muscles and the shoulder muscles here. And so it was really intense, but it was so relieving to have this area worked on as part of that course.
Yeah, I bet that must have been so good. Okay, so if somebody is watching this and then they suspect that they might have something going on in their TMJ and they could benefit from some TMJ therapy sessions, how does it actually work with the sessions, and if someone wants to come and see you?
Yeah. So if someone, would like to have some like TLC on their TMJ, they can either contact me or book online, and we can share those links. And the first step to making sure the sessions are geared towards them is that they will complete an online consultation form. And when people share as much detail as possible in those forms, I'm able to understand then their history of TMJ and to prepare the session so that they get the maximum benefit possible. So the first step is complete the online form, and then they'll come for their first session, and obviously we will then have a physical consultation. So I'll actually check what is happening in the jaw, what are their symptoms, what other things have they surfaced in their digital consultation form that we'll need to be aware of, because it may not just be in the jaw, as we said. Some people might be like, actually it's my shoulders, actually I'm getting headaches, actually it's my neck that feels tight, or something like that. So anything that's been included in the digital consultation form we'll check as part of the consultation in the session. And the sessions usually start with releasing some trigger points in the shoulders, and releasing these trigger points here can kind of clear the way for us to be able to work more deeply in the neck and face and muscles inside and outside the mouth. And the session all takes place on the massage table, so people will transition from being face down as we work on the shoulders to then face up to treat everywhere else. But we really do adapt the sessions to the person. So for example, I have a lady who comes with her small baby, and we do all of the session in a seated position on the table so that she can hold her son whilst I work. So we can adapt, if people have certain mobility issues as well. And then when the client is facing up and they're lying on the massage table on their back, we'll address any trigger points and issues that we may have found in the neck, still in the shoulders, in the muscles of the face, and then we'll go inside the mouth, because, for example, the masseter muscle here can hold a lot of trigger points in there and a lot of tension. So we'll release those, and there are also a pair of deeper muscles called the pterygoids, which internally sit around here and here. And I can access those best from inside the mouth. So I'll be gloved up and we'll work inside the mouth as well. And these can be really tender in some people. So we just make sure to stay in communication about how the client feels that day and what their body's capacity is for the session for that day. As I mentioned in the TMJ articles that we have, the best thing the client can do is to just communicate with me throughout the session and to breathe deeply to help in creating space and to allow the jaw to feel more open and relaxed. And we try and make it as relaxing as possible, a session for the person who's coming to have the jaw therapy. So we'll have the massage bed set up, we'll have, really soft lighting, we'll have nice music on, because we want people to not only relax their jaw, but to feel like they've had some time out for themselves to just generally relax as well, because that can all help in the healing.
Yeah, absolutely. And then what do clients generally feel after they've had that session or some sessions with you?
Yeah. So the thing that I hear most often, I think, is just like, wow, this feels so good. The sessions may feel intense during the session, but the jaw afterwards often feels so much more open and free. In many people, the clicking has stopped. In some people, the deviation has been corrected considerably. And the muscles in the face, the neck, the shoulders, and the head just feel way more relaxed. And that's just a huge relief for clients. Some clients who wear mouth guards at night have mentioned that they felt like they didn't need to wear the mouth guard overnight following one of the sessions, because they just didn't have that sensation of needing to bite on something through the night to keep it in place. So that's brilliant for them. Honestly, headaches can disappear, neck and shoulder tension can disappear. The results can be as varied really as the symptoms. And as we said earlier, the emotions can play a big part in this, and people often share that they feel a release of emotion, particularly some anxieties, whether they were conscious or subconscious to them, can just relax or fade away even, which people comment just makes them feel overall much lighter, and their well-being just feels massively improved. And so we do see results after one session, and for lasting changes to build on those results up from the first session, people generally need a course of these sessions to get out of pain and to return to the normal functioning of the jaw. And this also helps to kind of guide the body into new, healthier patterns. And so that course of sessions is generally when people feel the most impact and lasting benefits. And then maybe they'll come, maybe they'll come every other week for a certain amount of time. And then when they feel significant improvement, they may come once a month or so for a top-up.
Amazing. Sounds great. And just whilst we're here, you also do amazing restorative massage. So can you share with everyone about those three types? You've got the everything, which is the full body. You've got the buckle up, which is the mouth and the face massage. And then you've got the blend, which allows people to choose between a combination of the body massage and either the face or jaw work.
Exactly, yes. So massage is really where it started. And so the everything is just like a super indulgent and replenishing and relaxing and rejuvenating full body massage. It's 75 minutes. So, we work from top to toe, and that session, I think, just helps people recover their feel good factor, like people will either come, 10 a.m. They want the everything massage to start their day and kickstart their energy. So it works for those people, and some people will come at 7 p.m. because they want to have the everything massage and then go straight home to bed. It's just one of those kind of like, it's a feel good factor massage, and one that I love to share with people. And then, yes, we've got the Buckle Up, which is, it's spelled Buccal, and I've called it that because we work on the buccinator muscle, which is this one in the cheek. And so it is another inside the mouth massage that we take in the cheek, the jaw, the cheekbones, all of these muscles of the face, which feels incredible. But we also stretch out and relax the chest, the neck, the shoulders, the head. So it's really like the entire top, shoulders up, just gets stretched out and helps people feel like lifted and more awake, I would say. And then, yes, we've got the blend. So the blend is essentially a massage of around 45 minutes of massage, and then people can combine that either with the buccal massage, or they might want to combine it with some TMJ work. So typically people go for the TMJ because they're like, I've got this sensation of stress and tension and pain in the jaw, but I also want a back massage. So, that's the opportunity for people to bring those couple of things together in one session.
That sounds absolutely heavenly. So everybody run, don't walk to go book in. We'll share the link. It'll either be below the video or up in the link in bio. And that will take you directly to Lisa's online calendar to get your session reserved. Any questions that you have, we're available on the email address, which we'll also share below, or you can comment on the video.